Mombasa County health officials have issued a public health alert over the outbreak of dengue fever. According to the Department of Public Health, the disease has been on the rise since the month of February this year. They are now cautioning members of the public to take the necessary precautions to prevent the disease. Coast reporter Kevin Mutai tells us what those are.
The weekly data system for disease surveillance in Mombasa County shows that between the months of January and March 2021, both adults and children with non-malarial fever tested positive for the dengue fever. The last 2 months of monitoring have been grouped as an outbreak period, with patients displaying severe symptoms.
It can get serious. You can get admitted in the hospital with serious symptoms, because it affects vital organs in your body. It can also lead to bleeding. So that's how serious dengue fever can be.
Random blood samples were collected from patients suspected of dengue in different health facilities within the county between March and April, and it revealed that out of 47 samples submitted, 51% of them tested positive for dengue fever. Changamwe and Jomvu had 7 cases each of those who tested positive, Kisauni 6, Nyali 4 and Likoni 2. Samples were not collected in Mvita sub-county. According to the trend, public health officials declared the period the highest burden for the disease.
Majority are asymptomatic, meaning they get the disease itself, but they don't develop signs and symptoms. A few progress to severe stage. So those who manifest with the signs and symptoms, they develop headache, fever, vomiting, abdominal pain. Differentiating dengue fever and malaria at times is a bit difficult. That's why we say when you manifest with these signs and symptoms, the best thing is to go to the hospital.
Health officials are worried that if the weather reports are anything to go by, then the heavy rains which are expected between March and May, mosquito population might increase and will put the public at risk of getting infected with the disease.
There's a decline on the numbers between the month of February to date. And it's just like I said, it's widely spread. The disadvantage we have in Mombasa, we have so many garages all over, spread across the county. So these are the best breeding sites for mosquitoes.
Public health officials in Mombasa County have put in place a proper surveillance system to monitor the outbreak of dengue fever, as well as rolling out preventive and control measures to deal with the burden of the disease. Kevin Mutai, NTV in Mombasa County.